Imagine a dog just pulled off the streets. This animal's starting a whole new life. Rushing that critical process, it can actually backfire.
Completely. It can undermine the very immunity you're trying so hard to build.
And that is exactly what we're diving into today. We're unpacking this framework called D.R.E.A.M Immunity.
Yeah, for anyone involved in rescuing, fostering, adopting street dogs.
Now, this isn't medical advice, obviously.
No, definitely not.
But it's a collection of really valuable insights from vets, researchers, rescuers with years of experience. Think of it as a practical guide. Our mission here is to boil down the essential steps, and sometimes they're counterintuitive, you know.
While you really want to get those shots into them straight away, rushing vaccinations for a street dog can, and sometimes tragically does, lead to the vaccine just not working. Or worse. It's a tough lesson learned in rescue. Health absolutely has to come before haste.
Okay, so what's the absolute first non-negotiable step before anything else?
Get that dog to a vet immediately. No delay. Their professional assessment is the starting line.
Right, even before thinking about shots.
Think of a vaccine like a training manual for the immune system.
Okay.
It teaches the body to fight a specific enemy. But if that immune system is already weak, maybe fighting off hidden infections or just malnourished.
It can't learn.
Exactly. It's too exhausted or depleted. So you give the vaccine, it looks okay on the paperwork.
But doesn't actually protect them.
Right. You get vaccine failure. It's heartbreaking and sadly pretty common if you rush things.
Okay, the dogs at the vet. Always start with blood tests.
Strongly recommended, yes.
Yeah.
Always. A complete blood count, a CBC, gives the vet an immediate snapshot.
What does that show?
Well, for example, a high white blood cell count. That flags a possible active infection somewhere. Low red blood cells. That points towards anemia. And anemia is critical.
Why critical?
It affects energy, healing, everything, and crucially, safety under anesthesia.
I heard a tip about checking their gums, like a quick visual check.
Yes, that's a good field tip. Lift the lip, look at the gums.
And what are you looking for?
Healthy, consistent pink color. That's a good sign against severe anemia.
But not definitive.
No, definitely not. A dog can look okay, but still be anemic. The blood test is the real proof. And if they are anemic...
Fix that first.
Absolutely. That becomes priority number one. Before vaccines, before any thought of neutering or other operations needing anesthetic.
Because anesthesia is risky with anemia.
Very risky, especially if it's not gas anesthesia. Getting those iron levels up, resolving the anemia first, it can literally save their life on the operating table.
Okay, so foundation checked. Let's move to the first big pillar of D.R.E.A.M immunity. Worming and parasite treatment.
Yes.
What are these hidden dangers?
Oh, they're significant and often invisible. Heartworm, for one.
Spread by mosquitoes.
Yep, D.R.E.A.M immitis. Mosquito bites transmit the larvae. These worms grow in the dog's lungs, heart, causes massive damage.
Can be fatal.
Then you've got tick-borne diseases, stealthy ones.
Like Lyme.
Lyme disease, yes. And ehrlichiosis, anaplasmosis. These are bacterial infections from tick bites.
Nasty stuff.
Really nasty. Can cause fever, lethargy, joint pain, anemia, bleeding issues. And the real kicker.
What's that?
Ticks often carry multiple diseases, so a dog can get co-infected.
Making things much worse.
Exactly. Increases the chance and severity of symptoms significantly.
Okay, so how do we fight back? What are the deworming strategies? Different for adults and pups.
Yes, slightly different approaches. For rescued adult dogs, especially if they're prepping for travel, a good protocol is often biweekly or monthly deworming with a broad spectrum product. Depends on the medication and the dog's condition.
More frequent than typical pets.
Generally, yes. Pet owners might do every few months. With rescues, we need to be more aggressive initially. Now, puppies.
Start even earlier.
Much earlier. Worming should ideally start from 2 weeks old. Rescuers sometimes find tiny pups and might give, under vet advice, a very small piece, like less than a quarter tablet.
And dosage here must be absolutely precise, I imagine.
Oh, beyond critical. This is non-negotiable. Dosage is always by weight.
Get it wrong.
Get it wrong, give a whole tablet to a tiny puppy. It could be fatal.
Yeah.
Seriously. Always, always check with your vet.
Okay, for puppies, how often?
After that first dose, it's strictly weight-based every 2 weeks, right up until they're about 12 weeks old.
And you mentioned broad-spectrum dewormers. What are we talking about?
Things like Endopet, Drontal Canaverm are popular choices. They cover a wide range of intestinal worms. You need that broad coverage.
What about things like NexGard?
NexGard is excellent for fleas and ticks, external parasites, but generally it's not the go-to for internal worms. You need specific dewormers for those.
Got it. So, after diligently following this protocol, what are the signs you look for? How do you know the dog is healthy, worm-free, ready for the next stage?
You'll see a visible change. Clear, bright eyes. Gums and tongue a healthy, consistent pink.
Energy levels?
Good energy, good appetite. And crucially, check their poop. It should be consistent, well-formed.
Poop consistency. Okay.
Yeah. Generally, after about 12 weeks of proper parasite treatment, a dog should be happy, healthy, and ready for vaccination. Healthy puppies, maybe a bit earlier, 8-10 weeks sometimes.
And the poop check tip.
Always check their poop right before a scheduled vaccination. If it's loose or looks off, delay the vaccine.
Better safe than sorry.
Always. Patience here is key. Rushing is risky.
Okay, pillar 2, nutrition. Fueling immunity. Seems obvious, but how vital is diet?
Foundational. Absolutely fundamental. It's not just about filling their belly.
Right.
It's about giving the immune system the actual building blocks it needs to function properly. Good quality meat is key here. Liver, heart, chicken, egg. These provide essential amino acids, vitamins, minerals, and for younger dogs, say, under 8 months, a higher quality puppy food is really beneficial. If the budget stretches, preservative-free, grain-free options are great.
Okay. Now, introducing new foods to a potentially sensitive system. Any tips?
Yes, simple but effective. Go slow. Introduce one new thing at a time.
One food or treat or supplement.
Exactly. Let it pass through, see how their digestion handles it before adding something else. Avoids overwhelming their system.
Makes sense. You mentioned liver and heart specifically.
Yes, those can be incredibly beneficial, almost noticeably transformative for some dogs. Real boost to their overall well-being.
What about vitamin supplements?
They can be helpful if a dog is particularly unwell or run down. But generally, whole natural foods are the best source. The body usually utilizes nutrients from food more effectively.
Okay, so parasites cleared, nutrition sorted. Now we can finally talk about the vaccination program, but strategically.
Yes, strategically. This is maybe the most misunderstood part. It allows the body time to build its defenses gradually, to properly recognize and prepare for the big threats, things like rabies, parvo, distemper.
Parvo and distemper are the really dangerous ones for pups.
Hugely dangerous. Parvo hits the gut, often fatal. Distemper affects multiple systems, very severe. So the schedule is designed for protection with a multi-dose vaccine.
What does that look like?
Typically, first puppy vaccine, then wait 2 weeks.
Okay.
Then the first adult mixed dose, wait another 2 weeks.
Right.
Then the second adult mixed dose. The rabies shot often gets combined with that second or sometimes a third mixed vaccine, depending on how the dog's doing.
And we keep coming back to this. Don't rush it. Why is cutting corners here so bad?
Because it just doesn't work properly, whether it's someone trying to save money or just wanting to get the dog adopted faster.
Well-intentioned, maybe, but
misguided. Rushing compromises the vaccine's ability to actually stimulate a strong immune response. Remember, the dog needs time to clear worms, absorb nutrients, then the immune system is ready to learn from the vaccine.
So it takes time, optimal time, not just fast time.
Exactly. You need a robust, ready immune system for the vaccine to be truly effective.
What about keeping pups safe during this vulnerable vaccination period?
Isolation. Absolutely critical. It's just not safe for a puppy to be out on the streets or even in dog parks until they've had at least the second, ideally the third, round of shots.
Because of things like parvo.
Exactly. Exposure to parvo before they're fully protected. Survival chances can be less than 50%. Keep them safe, isolated, controlled environment until immunity is built.
And deworming continues throughout.
Oh, yes. Keep up the deworming maybe every 3 to 6 months leading up to travel. Then once they're settled, say in the UK, maintenance deworming every 6 months or so.
Any other vaccines later on?
Kennel cough is an optional one. Can be given later, maybe first 6-10 months. Many people don't bother, honestly.
Why not?
Well, antibiotics usually work if they get it, and the vaccine doesn't stop them getting it. It just helps their body fight it, maybe reduces severity.
Okay. And boosters for the core vaccines.
Standard practice is a booster shot 12 months after that initial full series.
Do you need to redo the whole series again later?
Generally, no. Once that initial immunity is properly established, boosters should maintain it.
Right. Okay, so we've covered initial checks, worming, nutrition, vaccinations. But what about ongoing monitoring? Some things can hide, right?
Right. Some nasty conditions can lie dormant. They might not show up in those first blood tests when you rescue the dog.
So they appear later.
They can. And that's where tests are brilliant. They're convenient, accurate tests run right there in the vet clinic.
Quick tests.
Yeah, using just a small blood sample, you get results in minutes for several really serious diseases. So heartworm, Lyme, ehrlichiosis, and anaplasmosis.
And those last two, ehrlichiosis and anaplasmosis, they're the tick-borne bacterial ones again.
Exactly, the sneaky ones that can cause joint issues, anemia, bleeding problems.
Do dogs always show signs if they have these tick diseases?
Not always. That's the tricky part. They can be silent carriers, look perfectly fine.
But if they do show signs,
then you might see fever, lethargy, lameness, joint pain. And research shows if they're unlucky enough to get infected with more than one of these from a tick.
which you said is common.
Right, then they're significantly more likely to actually show those clinical signs.
What if it comes back positive, or the vet needs more info?
Then they'll definitely recommend follow-up testing, sending samples off to a proper lab for more detailed analysis, maybe other diagnostics.
To confirm and understand the extent of it.
Precisely. And here's a really useful practical tip, especially for dogs being prepared for travel.
Yes.
Do another test, ideally the 4DX, about 2 weeks before their travel date.
Why then?
It gives you that crucial window. If something dormant has popped up, you have time to potentially treat it, get them cleared and healthy before they make that big journey to their forever home.
That makes so much sense.
Yeah.
Wow. This whole deep dive, it really lays out such a careful step-by-step process for building this D.R.E.A.M immunity.
It does.
We've hit the 3 pillars. Worming first, that fueling with nutrition, and then the strategic, unrushed vaccination.
And underpinning it all
is that core truth. Prioritize the dog's actual health. Build up their immune system properly. Don't rush.
It just works. It respects the dog as an individual. It can transform not just the dog's future, but maybe how we think about care itself.
It's a powerful thought. Patience really is key in rescue, respecting their biology.
Exactly.
Well, if you listening want to explore these ideas further, you might want to check out resources from D.R.E.A.M Dogs.
Yeah, they have some great information.
You can find their guide online at dreamdogs.org. Definitely worth a look.